December 4th, 2024.
The chief executive of United Healthcare, one of the nation's largest insurers, was killed in Midtown Manhattan around 6:45 this morning.
On the fateful bullet was carved 3 words: deny, depose, and defend. This mantra is how American health insurance companies profit off the pain and lives of their patients. So instead of mourning the victim, many people found themselves supporting the shooter. Because this wasn't just a bullet aimed at United Healthcare alone. It was a wake-up call about the rot in the healthcare system of this so-called democratic nation. Look at this chart and you'll see the harsh truth. Americans spend more on healthcare than any other country in the world. Not just a little more, a lot more. Healthcare accounts for 18% of US GDP, or roughly $5 trillion. And yet, strangely, Americans visit doctors 50% less often and have a life expectancy about 3 years shorter than other wealthy countries. That's not all. The US ranks dead last among the top 10 high-income nations for healthcare outcomes and access. Why is that? To understand this, we need to break down the US healthcare system into its 3 main components: insurance companies, healthcare providers, and pharmaceutical companies. Let's start with the first one: the insurance system. The American insurance system operates under 2 main programs: commercial health insurance claims and public health care programs. Imagine you're an office worker in America. Your company provides benefits, including health insurance. That insurance is purchased for you through a company like United Healthcare. When you go see a doctor, the doctor or hospital submits a payment request to United Healthcare to get paid for the service. That's called a commercial claim. Of course, you could also buy insurance yourself for your personal needs. The medical services and payments under that insurance are also called commercial claims. But if you are over 65 or have severe illnesses listed by the government, you are less likely to participate in this insurance program. At this point, the government will provide you with a healthcare program. This service is also divided into 2 types, including Original Medicare and Medicare Advantage. Original Medicare, where the government directly pays for the medical services you use. Of course, it does not include dental, vision, or physical therapy. If you want those services, you must use Medicare Advantage. Here, the government pays a fixed amount to a private insurance company, and they provide the medical services. When you go to the doctor, you usually go to providers under the insurance company, and you get additional benefits that Original Medicare does not provide. According to 2023 statistics, 89.1% of American adults had health insurance at some point. They usually come from employer programs, government-managed programs, or personal financial plans. The U.S. health insurance market was estimated to be worth $1.6 trillion and is still growing by about 6.8% each year. Its large scale and diverse products give people many choices. However, this also creates a big problem. In the market, each insurance company has its own payment codes, payment processes, prior authorization protocols, pharmacy networks, and doctor networks. Reports from Strata Decision Technology show that administrative costs alone account for over 40% of total costs hospitals bear in providing care to patients. 30% of the cost difference between US healthcare and other countries comes from these administrative procedures arising from insurance. But money isn't everything. To truly understand the negative impact of these procedures, we need to look at the corresponding service quality. On average, US insurance companies deny 16% of all claims. Specifically, United Healthcare, and Medica deny up to 32% and 27% of cases, respectively. This forces patients to make a choice: stop treatment or pay out of pocket. For those paying out of pocket, they almost certainly have to bear a huge debt. Medical costs are so high that 66.5% of bankruptcies in the US are related to healthcare. According to CBS News, nearly 40% of Americans skipped healthcare in 2022 due to cost concerns. Insurance companies argue that they do this to ensure hospitals do not provide unnecessary services. This sounds reasonable until you know these numbers. According to AHA reports, from 2022 to 2023, the number of denials by insurance companies for commercial claims and Medicare Advantage increased by 56% and 20%, respectively. Companies can deny so much because only 1% of denied people appeal. It's not that they don't want to claim their rights, but because the process is always very complicated and time-consuming. Even more notably, the success rate of appeals is up to 75%. Clearly, if the insurance company's denials were reasonable, the appeal success rate could not be that high. Companies simply deny as much as they legally can without even reviewing each case carefully. After all, only 1% will appeal. It's a perfect process as mentioned at the beginning of the video: deny, depose, and defend. However, the misery doesn't stop here. The operational process of insurance companies has a step called prior authorization. This step requires doctors or hospitals to get permission from insurance companies before performing medical services. Once again, insurance companies say they want to ensure all services are truly necessary. But is this more important than human life? 30% of radiation oncologists say they have seen patients require emergency care or suffer permanent disabilities due to waiting for approvals. For approval, doctors must draft an explanation and send it to the insurance company. It will be reviewed by other doctors on the insurance side before a decision is made. However, only 15% of these insurance doctors are assessed as competent in the relevant specialty. This unethical and unscrupulous way of working is partially formed due to market concentration. In recent years, mergers between insurance companies have become more frequent. Aetna merged with Prudential, United Healthcare with Sierra, and so on. Gradually, giant insurance companies were formed, dominating this lucrative market in the US. Instead of bringing benefits to customers by negotiating better service prices with hospitals, they used their power to increase profits. In 2010, the healthcare law limiting health insurance company profits came into effect. This law requires companies to spend 80 to 85% of their revenue on medical services. However, it only encouraged them to seek profits in other ways. For example, United Healthcare directly employs 10,000 doctors in its corporation and has commercial relationships with over 80,000 other doctors. This number is equivalent to 10% of all practicing doctors in the US. Once again, power concentrates and prices increase accordingly. Ironically, the US insurance system brings tremendous success to companies, not to protecting people's health. Simply put, US health insurance has truly failed. We have criticized insurance companies a lot since the start of the video. But they are not the only ones responsible for the failure of the American healthcare system. Healthcare providers are not innocent either. Doctors. Some may find it hard to believe, but doctors themselves have contributed to making the healthcare system so expensive. This chart shows doctors' salaries across countries. There are many reasons why doctors in the US are paid so highly. But the most important reason lies in supply. The US has 2.6 practicing doctors per 1,000 people, much lower than the average of other developed countries. The American Medical Association has long intentionally restricted the supply of doctors. 20 years ago, this organization actively lobbied to reduce the number of medical schools, limit federal budgets for residency programs, and cut a quarter of residency positions compared to before. They argued that a surplus of doctors was imminent. This puzzling move resulted in the number of medical graduates in 2005 being exactly the same as in 1980, despite the population having increased by over 30%. Beyond doctors, problems with healthcare providers also come from hospitals and investment groups. Like insurance companies, hospitals often go through mergers. In the past 20 years, there have been 1,000 mergers among the more than 5,000 hospitals across the US. Most of these mergers were conducted by private equity firms, aiming to reduce operational costs in clinics and hospitals. In theory, this should lead to lower prices for patients. However, because patients are captive customers, investment groups have enough power to increase prices. This is a perfect investment. According to a recent study, when private equity firms control over 30% of the healthcare market, service prices increase significantly. One of the most typical examples of price increases is U.S. anesthesia partners. After dominating the Denver market, USAP charged 30 to 40% higher prices than competitors. By establishing trade relations with the majority of anesthesiologists in Denver, insurance companies and patients alike had virtually no choice but to pay whatever amount USAP demanded. A University of Chicago study also showed that when private equity firms own nursing homes, short-term mortality rates increased by 10%. Another study from Harvard University showed that healthcare quality decreased when hospitals were bought by private equity firms, reporting a 25% increase in complications and a 38% increase in sepsis rates. To maximize profits, the best way is to increase revenue per patient and per doctor. And since most private equity funds are financed through loans, they face pressure to generate cash flow to repay debt. To summarize, for healthcare providers, what they pursue is controlling supply and raising prices to make money, without caring about the corresponding service quality. The final factor behind the failure of the US healthcare system is pharmaceutical companies. Obviously, you can't treat illnesses without medicine. The US accounts for about 44% of the global pharmaceutical market, worth about $600 billion. Per capita, Americans also spend more on medicine than any other country in the world. But are they buying better medicines at higher prices? Sadly, no. They are buying the same drugs, but at much higher prices. According to Bloomberg, the 8 best-selling drugs in the US are much more expensive than in other countries. The most typical example is Gleevec, a drug for chronic myeloid leukemia. It costs over $90,000 more per year of treatment than the global average. But the craziness doesn't stop there. Even within the same state, drug prices vary. For example, Zytiga, a prostate cancer drug, has over 2,200 different prices under various insurance plans. In northern Michigan, you would pay $815 for this drug. But just going down south, the price jumps to $3,400. The main reason drugs are so expensive in the US is because the government does not negotiate directly with pharmaceutical companies. They are not even allowed to negotiate due to the non-interference clause. When bargaining power is fragmented, America cannot leverage the scale advantage it should have. Have you ever wondered why pharmaceutical companies pay doctors? It's simple. They want everyone to use their drugs. And doctors are the ones who prescribe them. Pharmaceutical companies offer illegal kickbacks and other incentives to ensure doctors prescribe their drugs instead of competitors. Sadly, this behavior is increasing. Since 2014, payments related to drugs have risen from $6.5 billion to $12.8 billion. How can you be sure your doctor is objective when they are sponsored for research, paid for speeches, hired as consultants, and worst of all, bribed? There are dozens of examples of such misconduct. Novartis in 2010, Pfizer in 2014, and more recently, Purdue Pharma with the opioid crisis. This is not just financial crime. It is a crime against humanity. The US pharmaceutical system has completely failed as well. Americans not only have to pay enormous sums for the same drugs, but they also cannot be sure they are being prescribed the right medicines. Simply put, the US healthcare system is extremely complex. That complexity creates serious inefficiency, leading to a failure in achieving universal health outcomes. However, if you are rich, the US healthcare system might be one of the best in the world. America has the most advanced technology, the most modern facilities, and probably the best doctors in the world. But what is the problem? You must be able and willing to pay for it. Healthcare is a business, that's true. But sometimes the price is morality, humanity, and even lives.